What's going on, guys? I'm Bill and welcome to Training with Bill. So this is my 1 week post-surgery update. As you can tell, I'm a lot happier than I was 1 week ago, so that's because the pain is starting to die down slowly. I'm starting to get some movement in my shoulder, which is awesome. As you can tell, I've taken off the padding. After the first 48 hours, I took off the padding that was on my left shoulder. So in case you guys haven't watched this, the previous videos, I had a tear in the labrum of my left shoulder and also was dislocated. So that's the reason why I had my surgery, and that was last Friday. It's now just over a week since I had my surgery. Things are slowly progressing. I haven't seen the surgeon as of yet. For my update, that'll be this Friday, so that's in about 4 days or 3 days time. So I'll have a lot more information on that day with regards to exactly what he did and what my progress is going to look like in terms of recovery for the next couple of months, or hopefully shorter than that. So the way I feel so far, I feel as though I'm recovering fairly quick. I'm very, very happy, especially because a lot of the videos that I watched prior to having my surgery were a bit concerning, to be honest. A lot of people on YouTube pretty much got up to the 6 to 8 week mark, even some people up to the 14-week mark, and they were saying that they could only lift their arm about that far, and that's as far as they could get. So that was definitely scary. That's not what I want. I want a speedy recovery as quick as possible, and a successful recovery. So far, to be honest, it's looking pretty good. I'll show you guys in a minute. I'll take off my sling. I can hold up the weight of my arm, which is unreal. Makes a huge difference. Now being able to at least use my hands to help me out, and if I need to grab something or whatever it is. So it's a lot better now. The padding that was on here, once I took that off, I was good because I was able to have a proper shower then without having to cover it. Also, what I noticed, which was interesting, when I had to take off the little pads that were on here on my shoulder, because a little bit of water started to get in behind there, when I peeled one off, it actually peeled off the little bandages that were over the hole or the incision where they initially put the arthroscopy through. But what was interesting was that there was no stitches. So whether they've dissolved already or I had no stitches to begin with, that's extremely interesting, and I'll be finding that out this Friday when I see the surgeon, because a lot of people that I do know of that had the shoulder surgery obviously have had to have stitches, and to be honest, my holes, which I'll show you guys in a second as well, it's very, very minor. So I honestly believe it all comes down to the surgeon. The surgeon that I'm dealing with is unreal. He's very, very good, professional, and he's got a very high reputation. So I'm really glad that I kind of ended up with that surgeon and not somebody that's going to butcher me and leave me with a lot of scarring. So it's very interesting. Also, what else is interesting is that of most people that have the keyhole surgery or the arthroscopy usually have 3 holes. It depends on really what work was done, as far as I know. So I'll be also finding that out on the Friday, and we'll be able to move on from there. But overall, in terms of recovery, I'm pretty happy. My sleep is slowly starting to get better, and that's probably the worst part of this whole ordeal, your sleep. Because if you can't sleep properly, which is very, very hard, I have to sleep in this sling, and it's not easy to sleep. I've seen a lot of people suggest getting a recliner chair or a lazy boy, something along the lines of that, and they just sleep in that for a couple of months. I've been sleeping in the bed. However, I have to sleep like a vampire and just sit up like this. So it's not fun. It does ruin your night, and unfortunately that leads on into the day. So if you haven't had a good sleep at night, you kind of go through the day like that. Also, in case I don't want you guys to jump off quickly, the weight loss challenges have begun. So if anybody else out there is also waiting on those, I've got a few more days left of my challenge, and then I'll be uploading my results, which hopefully should be very interesting. Back onto my surgery update. So like I said, sleeping is a nightmare. That's probably the worst part, especially if halfway through the night you decide to try and roll over. You'll definitely wake up and feel that pain. So once again, your pain medication is going to help you get through those nights and also throughout the day. I'll also find out this Friday with regards to when I can actually take the sling off permanently once I start physio, any kind of treatment that also needs to be done. So I'm really looking forward to the Friday update so that I know exactly where the future of this surgery is going to really lead me to. I really need to get back to work. I need to get up and get moving. I can't just sit at home. This is the longest I've ever been at home doing nothing. I'm usually a very active person, and I'm just can't wait to get out and get started get back into training, get back into work, get back into having a normal life instead of just sitting at home like a vegetable. So, like I said, sleeping is the worst. You're going to have problems with showering yourself. Obviously, you know, you can get under this arm slightly as you hang your arm down to wash under your arms. That's another big problem. Because your arm is just stuck to your armpit the whole time. I'm going to warn you guys, you're going to sweat. It might start to get irritated under the skin. So whether you shave or don't shave, I think you're going to have problems regardless. You might have ingrown hairs if you shave because it's always squeezed together the whole time. And also if you don't shave, well then you're going to smell for a while. Possibly, I don't know. Look, it's not the greatest feeling. It's hard to kind of get any kind of spray under there or any kind of roll on. It's not the best experience, but I've been showering like twice a day just to try and avoid that smell. What do you want me to say? So that's another bad thing. So sleeping, showering, obviously your personal hygiene. So going to the toilet's not fun. You have to learn to wipe with the other hand or depending on which hand your shoulder's injured or your shoulder is limited in. So overall it's not fun. I'm having to learn to do different things. Pretty much with my right hand has taken all the work load off my body. So interesting thing, I'll just try and move back a bit. So you can see the size of my right arm compared to my left. My left arm is starting to lose muscle mass already, so I'm not looking forward to that. I've been trying to use my left shoulder, but I've been trying to also avoid anything excessive. I don't really know how much I'm supposed to move it. Even when I had the surgery, the nurse also said that you might feel like you're able to move it, but you have to try not to actually do any movements to make sure that you don't reverse any of the surgery process. So like I said, right arm, and then we turn around for the left, and you can see it's a hell of a lot smaller. So I'm already losing size, definition, shape, overall thickness. I really wanted to measure my left arm, but I can't really get a tape in there and do it myself, so I've kind of avoided it. So once again, left, right, huge difference. So I'm looking forward to getting back into training, and I might have to do a lot of symmetric movements or something to just kind of get the same size back on both sides. So I'm looking forward to that. I'll show you guys actually the back. I'll try and peel that off and get a good view so that you guys can see there's actually no stitches there. So I'll try and zoom that in. I don't know, it looks like there's no stitches, to be honest. There could be somewhere inside, but I can't really tell. But like I said, they might have dissolved, or I never had stitches. So that's a really good thing that I'm happy with as well. Minimal scarring. I don't really want any extra scars more than I already have. So yeah, that's my update so far, guys. So everything's looking good. I'll take off my sling. I'll show you guys how much I can actually move my arm. I can move my shoulder a little bit. I don't know how much I'm supposed to be pushing it. A lot of people online say that you shouldn't baby it, and then some people say that you should. So it looks like I'll be getting my advice straight from the surgeon this Friday, and then I'll know exactly what to do. So at the moment, I've just been restricting everything I've been doing. Like I said, you can't move around too much. If you even start walking around a bit too much, your arm obviously starts swaying around, and then you start feeling it. It gets very fatigued. It kind of feels like you've got baby muscles. So like you're a baby and you got to develop all that strength all over again. So it's very, very weak. But I'll show you guys right now just how much I can move my shoulder. So I just remembered another important thing. I'm the kind of person that doesn't like to wait or put a burden on somebody else. I like to do things myself. So what I found was a way to actually remove the sling myself and also shower myself and do everything myself, put on your clothes and things like that, things to avoid. So obviously I can't wear any shoes at the moment because I can't tie my shoelaces. So I'm always walking around in sandals or something along the lines of that, or barefoot. With regards to the shirts, I haven't worn a shirt for 2 weeks. I've just been wearing singlets, so they're nice and easy to take, to slide on yourself and kind of manage yourself in that way. Like I said, I don't like to burden anybody. I'll do things myself. And I'll show you guys. I learned a pretty easy way to be able to manage everything so that I can take the sling on and off myself. So like I said, if I take that off, initially when I first had the surgery, once I had removed these little Velcro straps here, the arm used to just want to drop on its own. So what I found is if I put a little bit, just the slightest amount of tension on this little cushion here, it actually holds my shoulder up. And then what I do at that point, I can undo the buckle that goes around the back and also over the top. So now that I've got my arm off, I'm actually putting that tension onto the little pad, so I don't have to put too much weight. Hopefully you guys can see. So everything's off. just the slightest amount of pressure, and then once that's off I can then drop it and my arm can come down. So as you can see, I can drop it down, no problems. Obviously once I start turning around like that, I can start feeling it. With regards to how much I can move, I can probably bring it up that far before I start to feel a bit of tension. I don't know if that's tension because of the muscle was damaged or whatever work was done inside, or if it's just something that's going to take time to heal. So I'm really struggling to move it. I don't know how much I can move it. I can force it all the way up, probably to about here, but like I said, I'm not sure if that's the right thing to do. So once again, left arm, right arm. It's not looking too good, but once again I'm excited to be able to get my sling off. Probably the last piece of advice I'm going to give you guys before I end this video is, if anybody out there is going to have this surgery, every surgery recovery is going to be different, so hopefully your one's going to go pretty well and successful once again, just like mine is so far, I'm assuming, hopefully. But one thing I can note to you guys is get a good sling, because this sling has been on my arm almost 24/7. I only take it off if I need to have a shower, and that's pretty much it, to be honest. So majority of the time the sling is on my arm, and the sling is the most important thing. So if you're going through the public system or whatever it is, or somebody's going to give you a sling, pay that little bit extra or ask if you can upgrade to a better quality sling. It makes the world of difference, especially sleeping. You've got that little cushion that's in there, so your arm's propped up the whole time. Also, when you're sleeping, put a pillow behind the shoulder so that you can always just lean over onto that side and you don't have to kind of put any strain on your shoulder. So once again, I can put this back on, same way. I just hold it with my right arm, slide my arm in, and that can take the weight. Once I've got the weight off, I just hold it up against the body of my arm or back against the cushion, put a little bit of padding, put one of these the Velcro straps back on, and then what I do is I just lean over while still holding this in place. So just lean over, take that strap over the back shoulder, and then I can clip that into place. Once that's done, then all the tension is completely off. My arm can rest 100% back in there, and then I can fix these straps back up. And once again, run the back, clip it in, and then get my thumb in place as well, which is also very, very important, because you don't want your arm dropping down the whole time. Oh, that reminds me. You have to, at least a couple times a day, take your arm out of the sling, and the reason for that is because your elbow will start to go stiff. So it is the worst pain. I think it's almost as bad, if not worse, than my shoulder, having a stiff elbow. So what happens is, because you're not moving your arm, it actually stiffens up by keeping it in this position the whole time. And then as you try and move that elbow, oh, the pain is unbelievable. So what you have to do a couple times during the day, just take your arm out of the sling and just exercise that up and down. Just try and get that movement back into the elbow. The last thing you want is to have a stiff elbow. It is a nightmare. So once again, I'm doing that. And also I've been doing little exercises, which is just a pendant movement. That's what they call it. So all I do is, I'll show you guys on my right arm. So I pull my arm out of the sling, and then I just lean forward, let my arm just hang there, and I kind of just sway around and let my arm do all the work. So as you can see, just swinging around, let that arm swing around, and that kind of just breaks up that movement in your shoulder and allows it to start getting some mobility, and also building up that muscle without having to actually intentionally engage the muscle. So guys, hopefully you guys have enjoyed the video. As always, like, comment and subscribe. I'll update you guys back on this Friday with regards to my surgeon update. Hopefully you guys have enjoyed the video. If there's anything else you guys would like to see, put it in the comment section below. Until next time, I'm Bill. Thanks for watching Training with Bill.